ครับผมขอบพระคุณคุณหมอทวีสินมากนะครับ So I'll begin with the English language summary for the daily press briefing here at the CCSA, and today is Friday, the 22nd of January 2021. A very important news just to announce first, as mentioned by Dr. Tuisin just now, is that there had been found a case of positive COVID case of a male presenter, a newscaster at NBT station channel 11. That individual has actually been in contact with two of the MCs here. Two of the MCs, NBT MCs here, who were working here at the CCSA studio. However, these two Master of Ceremonies, MCs that you see every day, they are actually in the risk group because they have been in contact with the NBT personnel. They are now undergoing the swab test right now, and we'll know of their results. The results of the swab test later this afternoon. As for us here at the CCSA, we have been in touch with the NBT presenters working here at the government house, and of course with all the risks involved and in terms of precautionary measures, we here at the CCSA are actually considered the lower risk group for this particular case. But nevertheless, all of us here in the studio, including myself and Dr. Tuisin, will be taking our own swab test at the hospital later on this afternoon and hope to see a negative result. And we'll report that to you later on as well. This has been reported just a few moments before this broadcast. It's been reported in the news. So just to recap that, of course, working at the CCSA and working with all the risks involved and living in society, that of course is always a risk for all of us. But nevertheless, we have to work with people. We have to keep things moving to inform you of the important information every day, and that comes, of course, with this risk. In any case, people here in the CCSA, around the studio, all our staff here, we're in the low risk group, and we'll take the precautionary measures and the swab test later on this afternoon. So I'll move on to the general situation and the number of cases that we have for today. We have for today reported 309 cases for today, out of which 80 are local transmission cases, 217 are from cases of active case finding, and 12 cases are from state quarantine. So you can see, excuse me, you can see in the number that the majority of the new cases reported for today are from active case finding. The total number of people currently under treatment with active cases now stands at 2,809, making the cumulative number of persons infected in Thailand since the beginning, since last year, at over 13,000. And number of recoveries reaching over the 10,000 mark now. And fortunately, we have no more fatalities to report to you today, no additional, making the fatalities standing at 71. Just some observations from the briefing of the spokesperson. Active case finding in Samut Sakhon in particular revealed the numbers 261 infections from active case finding, particularly in Samut Sakhon province. And Bangkok actually in itself saw only 13 new infections today. In terms of the provincial tab, up to now 63 provinces in Thailand have been reported with infections as of the number of yesterday. So we have some information for the English language audience here. The first is about the approval of the first batch of vaccines. The public health minister revealed that the FDA recently granted approval for the AstraZeneca vaccine, thus allowing Thailand to begin inoculating the public in this new wave. So aside from the shots to be acquired from AstraZeneca, this regulatory approval will also open the door for vaccine imports by private companies to help administer the doses to people who are taking the dose. The wider availability of vaccine will also help revive various business sectors in the country, And some of these doses will be locally produced, as mentioned yesterday, through technology transfer, and are expected to be ready for distribution within May. This is the AstraZeneca batch. Meanwhile, the approval of the Sinovac vaccine is scheduled to be still now in February, after which the drug can be distributed for vaccines straight away. The government has targeted to inoculate at least 50% of the nation's population before the end of 2021. Another advisory is on how to take care of elders, for elders to stay safe from COVID. Advising simple steps. You have an infographic there from the Public Relations Department, courtesy of the Public Relations Department. This includes DMHTT, avoid leaving the house when necessary, separate utensils in the house, personal items, and the like. So the DDC also further cautioned for elders in particular about chronic diseases such as high blood pressure and diabetes. They should remain at home, remain safe, rest a lot, and avoid going outside as much as possible because they are high risk of being severely infected. It suggested also that the elderly can find light exercise to do to stay healthy and relaxed while staying at home. Another point is, as you may have seen in the news already, the preventive measures in some cases in some provinces, particularly in Bangkok Metropolitan Administration, or BMA, announced yesterday that it will now ease restrictions on 13 businesses starting today, previously temporarily shut due to the new wave. The BMA said that since the daily infections have lowered in the past few days in the Bangkok area, these 13 businesses should be able to reopen, including game arcades, internet shops, beauty salons, spa, massage parlors, fitness, dance, and martial arts school, to name a few. And you have an English language infographic there up on screen, courtesy of the Public Relations Department, and I think also credited to the Bangkok Post as well. So several other provinces have also relaxed certain COVID prevention measures after seeing signs of that the local situation has somewhat improved in particular provinces. In Chiang Mai province in particular, they have allowed pubs, bars, and walking streets to reopen and are now allowed to serve alcoholic beverages. In Chainat province, another province, they have reopened community markets, farmers markets, Pracharat markets, small-sized flea markets, and in Nakhon Ratchasima province, also preparing to ease some restrictions as well. So, of course, as you see, this is according to the local context of each province. As we see the numbers start to get steady, less local transmissions, more of the numbers that we find are from the active case finding. And as I mentioned yesterday, we're reaching it's the 22nd now, but we're reaching 1 week to go until the end of January, which will be our, so to speak, so-called cut-off time in terms of analyzing our response to this new wave thus far. Another piece of information, as I always mentioned about international cooperation, the World Health Organization, or WHO, Thailand office, rolled out some infographics on the COVID prevention and knowledge, which is very useful. And you see that on screen right now. They're working with the Thai government to help provide information and knowledge for the Thai people and people in the region. It's also in English as well. These include infographics and short video clips explaining COVID and self-prevention steps against the virus. Some examples on screen now. You can see that on social media. It's also an easy, light-hearted way to learn more about COVID and how to prevent yourself against the virus. And you can always visit the WHO Thailand's Twitter and website, which is worldwideweb.who.int/Thailand. So just in closing, although there is a high number of infections today, note that they are from active case finding, our missions, where medical personnel have carried out testing among the public in specific areas, especially risk areas, and to see if anyone has contracted the disease and to control the spread as soon as possible. So this reflects the success of the missions, and we know them ahead of time before they spread locally. I cannot stress enough on the importance of DMHTT, as I've been mentioning this, that most cases found in Thailand are asymptomatic. And so we must learn to remain vigilant and cautious to keep ourselves and those close to us safe. So just to recap the beginning part that I mentioned, and with this quote, that it might be stormy now, but rain doesn't last forever. I think that's very self-explanatory, very touching. In the beginning of this briefing, I mentioned about the discovery of the COVID positive case of an NBT Channel 11 personnel who had been in touch with the MCs of NBT channel who have been working here at the CCSA at the government office. So that those two MCs, the gentleman and the lady that we see quite often, they are in the risk group, and they have been they are currently doing the swab test as we speak. So for us here, for myself, no worries. We are in the low risk group. We're the secondary group, actually. But nevertheless, for precautionary measures, all of us here, later on today, this afternoon, we'll go straight to the hospital facility to conduct our own swab test with the hospital, and hoping that we will have negative results and be able to take the necessary precautions and come back to you with the important information that we report to you every day. So as you notice, that's why today we have no MCs, and Dr. Tweesin and myself had to begin and introduce our briefing by ourselves today. Nevertheless, we will stay strong. As the quote just now, if you read it once again, it might be stormy now, but rain doesn't last forever. Thank you very much for your attention. Sawasdee krap.